Hey everyone, it's Kathy here. Welcome to another episode of Unfiltered and Caffeinated. If you are new to this series, this is a place where I just sit down with you all and chat a little bit more about some PT, health, wellness content over a cup of coffee or tea. So if you are ready, go ahead and grab your drink, take a seat, and we'll get started. Okay, so for today's episode, I have my NASA mug, and it's kind of cool because it's like 3D pop-up. And I really love this mug because one of my patients gave it to me as a gift last year. He worked at NASA, so I learned a lot of cool things from him. He was super smart. But anyways, I've got some Vietnamese coffee in here. Let me know what you're drinking, if it's coffee, tea, water, something else. Let me know down below. So I feel like I've had a lot of friends and family recently approach me about their knee problems that they've been having. And a lot of my family friends are super active to the point where they'll not take any rest days, and so their bodies are just always running on empty. So this is just, I think, a really good place for me to kind of chat about it a little bit. So the questions I'm going to answer today are: why do I have knee pain? What are some of the causes of knee pain? Which is super generic, so I'll kind of just go over like the reoccurring pattern that I see with people who have knee pain and go over it very briefly, and then we'll kind of go over, what to do if you have a meniscus tear and some of the research with that, and we'll go over jumper's knee, runner's knee, like super briefly, just to give you a better idea. And then if you have any further questions, you can let me know in the comments below, or we can schedule a consult call to kind of go more in depth on it for you specifically, if these are some of the things that you are having difficulties with currently. Okay, knee pain. Knee pain sucks. It's awful. Knee is a pretty intricate joint in that there's a lot of muscles kind of crossing over that joint, right? So we have our quads, we have our hamstrings, calves, our tibialis anterior, so those muscles in the front lower leg there. We have a lot of stuff going on, not to mention all of the ligaments and the cartilage in the knee itself that can get irritated or have tears or ruptures. So knees can be pretty complicated, and the rehab for it, if it's like a tear or rupture in ligaments, can be quite gruesome, as some of you may already know. Luckily for the other rehab stuff like jumper's knee and runner's knee, those are a little bit more forgiving. Oftentimes when I get patients with knee pain, almost always, I have seen them have weak hip muscles and weak glutes, which makes sense as to why they may be getting knee pain. So if you think about the leg, when you are doing activities such as running, jumping, cutting, all of those require your whole body to work. And we can't just isolate that knee, because the ankles, the hips, it's all connected and is all part of the leg that's working when you're doing those jumping, cutting movements. So it's really important to address the joints above and the joints below. So what I mean by that is, if your hip muscles aren't strong enough to absorb the impact, then a lot of those forces are going to your joints, and oftentimes it goes to your knees. So if you're thinking about the body, it's made up of the joint, the muscles, ligaments, cartilage, nerves. There's so many components, right, to the body. All of those things I listed are different team members. If your muscles aren't strong enough to perform repetitive jumps throughout the hour of your basketball game, for example, that means all of the other team members have to pick up the slack for the muscles for that one team member that isn't doing its job. And like I mentioned before, the joint is one of the components of the body. So if what I mentioned earlier about oftentimes I see hip muscles being super weak, if they aren't as strong, then that means the joint, the ligaments, everything else are having to compensate and play a bigger part when it comes to the activities you're doing, like jumping during the basketball game, in order to keep up. However, you don't want your ligaments and your cartilage and your joint to be taking all of that impact. It can take some, but you really want the majority of it to be absorbed by the muscles and controlled by the muscles. So that becomes a real issue when that's the case, when the other team members that aren't the muscles have to compensate. And that's kind of where injuries happen. If you have a meniscal tear, you don't necessarily need surgery to get better and return to your activities. You also don't necessarily need to go cold turkey and cut out all of your activities either. The studies show that when it comes to surgery versus PT, as far as the first intervention, the surgery didn't show to be superior than PT route, meaning choosing to go through surgery doesn't mean you'll have better results than if you started with PT first. And if you think about this, surgery is an invasive route. PT is a conservative route. If you go through surgery, you'll end up having to do PT afterwards anyways to rehab that knee. So you might as well try the conservative route before you even do the invasive route. And that'll also save you time and money. I've known a lot of people who have had meniscal tears, decided not to get surgery, and were still able to go back to the activities okay. And this is by making sure that those muscles that we were talking about are strong and can handle that level of physical activity that you are putting it through, and that the exercises what we focus on are specific to what you need, to what you individually need to make sure you can return to your activities okay. So what I mean by that is patients who come in as runners, there are certain muscles I want to focus on with them, but it's going to look way different for people who are gymnasts or football players or hikers, volleyball players. They have different movements in their bodies, and we want to make sure that we are strengthening it in those specific activities to make sure that they can return to those activities without the pain. Basically, what I want you to know about meniscus tears are, if you have one, you do not necessarily need surgery to get better. You do not need to cut out your activities altogether. You can return back to your activities as long as we are addressing the issues at hand to make sure that you are ready to go back to those activities. And rest isn't really gonna do it either, because if you know you have a meniscus tear, rest isn't gonna be strengthening those muscles around it to help provide more stability and shock absorption from the activities. But strengthening will help with that. So that's just my thoughts on the meniscus. Let's move on to the next topic. Next topic, we'll discuss runner's knee and jumper's knee, and I'll kind of clump them together because, again, I see a lot of patterns and similarities with these knee issues. So let's go over jumper's knee first. This is found often in basketball, volleyball players, because there are a lot of jumping movements throughout the practices and games. And so what happens with jumper's knee is you'll usually find irritation or pain right below the kneecap on the patellar tendon. For runner's knee, that is pain or irritation right behind the kneecap, so the patella, and sometimes you might feel like grinding too, which is often found in a lot of younger adults and runners, hence the name. But with those, what I find is that oftentimes people with jumpers or runner's knee are doing the same activity repetitively. So over and over and over and over again, putting your body through the same stresses. And what happens with that is your body may need a rest day here or there, because I know people who have this aren't the best at giving themselves rest days, which are super important. But then also we need to look at other activities we may be able to include that will allow you to cross train and use those muscles in different ways than the same repeated motion that you're doing with either running, jumping, all of that. So for example, if you only run, adding lifting to your activity will help immensely, because it will strengthen your body in different ways that it isn't able to do when you are running, and it'll actually help your running in the long run. Another thing is to look at form on these patients. So looking at their running mechanics to see if certain body parts are stressed more than the others because of lack of mobility, lack of flexibility. It could be a number of things. So you really want to look at the running mechanics. With a lot of our jumpers in like volleyball, basketball, I really want to look at how they're jumping, so right before they're jumping, but also how they're landing, because if their knees are caving in before and after the jump, like landing, then that's where we want to make corrections, because a lot of that will be absorbed in that knee joint there, and we don't want that. We want the muscles to be able to help absorb all the shock and forces when you are landing, and we want it to be done properly. And so if you are constantly doing these jumps for the entire hour or two for your game or practices, and you're doing it incorrectly, it's no wonder that you may be getting some knee pain, especially if you're doing that for 1-2 hours. If you're playing like 5 times a week, that's 5 to 10 hours that you are stressing your knees in ways that it is not supposed to be stressed. And so that's when physical therapy really comes in handy, because we can literally see what needs to be worked on. We can test and measure muscle strength, flexibility, joint mobility, all of these things to really find what it is that you specifically need in order to rehab properly and get your knees feeling better. So if you are dealing with jumper's knee or runner's knee, taking a look at strength, specifically hip, glute strength, and then trying to add cross training into your regimen, adding rest days in between your activities for the week, and then looking at form. Those are some things that you can work on. If you have knee pain, I highly recommend seeing a physical therapist, especially if it's something that's ongoing and you are, someone who really enjoys your sports and really wants to do it all the time. That's great. That's awesome that you want to get physical activity, but also remember that your body is not a machine. It's not made to go at 100% every single day. It's gonna need rest. And if you've been kind of running it on low, on empty, then that's not really gonna do it good. And we really need to kind of discuss ways to find balance where you can still be active in a way that is healthy and sustainable for your body, so that years down the line you won't be having knee pain. Because trust me, I've seen so many patients later on who've had so much knee pain that they end up needing knee replacements kind of early on in their days, and I just really want to prevent that for you all. So if you have knee pain, seek out a physical therapist. Let me know. We can always schedule a consult call and we can discuss more, because this is something that I would love to address with you and find a proper regimen and ways to help you heal properly so that you can still do the activities that you love without pain. To wrap up everything that we discussed, you know, the body is made up of a lot of different components, a lot of different systems. If one component is lacking, then the other team members are having to pick up the slack. And if that means like the ligaments and joints are having to pick up the slack, then that just increases your risk of injury. So we want to make sure that we are addressing the other systems and getting them nice and strong so that we can prevent any type of future injuries or, you know, knee replacements, surgeries, things like that. Secondly, if you are dealing with any type of meniscal injury, definitely try physical therapy. If you haven't yet, don't feel like you have to cut all your activities cold turkey. There are definitely ways that we can go about it to help you rehab and get back into the activities that you love with modifications. Lastly, if you have any knee injuries such as jumper's knee, runner's knee, really try strengthening hip muscles, cross training, adding a rest day here and there between your activities, and then seeing a All right, so that's all I have for you all today. Thank you for joining me on today's episode of Unfiltered and Caffeinated. If you have any other questions, topics related to PT, health, wellness that you want me to discuss, let me know in the comments below and I will get to it in a future episode. But until then, you all stay healthy and let me know if you ever need anything, and I'll see you on the next episode. The knee.